show started here. There we go. We may get one or two more people coming in, so we'll see what happens. Hi folks, my name is Patrick Myers and I'm a psychologist, and I some of the time work downstairs in a place called Complement Healthcare. It's a group of people who are healthcare practitioners in a variety of fields, and so that's where I work. Tonight I'm going to be talking about anxiety and worry, and so I'm going to start off by telling you a little bit about anxiety. I'm going to give you some statistics about anxiety, and then we will get into some ideas on how to deal with worry. The basic model that I'll be using is something called cognitive behavioral therapy. I won't be able to do the entire thing tonight, but it'll give you a little bit of a feel for what cognitive behavioral therapy sort of attempts to do, all right? So here we have, I don't know if you guys remember this guy. This is Pogo. We have seen the enemy, and he is us. And sometimes with worry, that's exactly what happens, is we are our own worst enemies. So to paraphrase the Buddhists, I keep on using this one over and over again. I paraphrase the Buddhists and I say, in life, pain is mandatory, suffering is optional. And unfortunately, many of us do suffer. So we have, this one is some American stats, although Canadians are similar. 26% of adult Americans report on being on the verge of a serious nervous breakdown. A whole bunch of people have different problems, such as neck pain, eye strain, hand pain, difficulty sleeping, and these are all related to workplace stress. I like this one. 40% of workers describe their work environment as a real-life survivor program on TV. So. And then 56% of people report anxiety if they can't access their email, and lots of people continue checking their email when they are on vacation. This one comes from StatsCan. About a quarter of us would report to StatsCan that most of our days are extremely stressful. So that's about a quarter of us. The most common sources of stress are taking on too many things at once, not enough money, others' high expectations of you, childhood trauma, and want to move but can't, and also a number of other things such as kids, divorce, underappreciation, demotion, or fired at work. This also includes 30% of Canadians who end up working shift work, and 30% increase in Canadians working more than 40 hours a week over the past decade. So chronic stress, I'll be doing a presentation later on chronic stress. It leads to all kinds of problems. In particular, in the StatsCan, there was arthritis, headaches, back problems, emphysema, ulcers, and heart disease. This one is the Centre for Addiction and Mental Health in Toronto. 10% of Canadian employees between the ages of 18 and 54 will suffer from mental health issues. And this is going to cost the Canadian economy a walloping amount of money. $51 billion is what their estimate is in lost productivity. Anxiety goes right across the board. It impairs your work, your home, and your social life. So the approximate figures are that 12 to 18% of Canadians are going to experience some form of an anxiety disorder. And the other thing that you're also going to find is that the ratio is about 2 to 1. Interestingly enough is that when anxiety sticks around too long, you will often find that anxiety accompanies something called depression. So we figure that about 7.9 to 8.6 of Canadians are going to experience depression as well. I noticed that you're taking some notes, and I have a few handouts there if you would like. I don't know if you want. And if anybody, I've only made a few handouts up. If anybody wants a colored version of the handouts, you can email me. Every now and then my email pops up here. You can email me and I'll send you a colored version of the handouts.
You mentioned arthritis. Were you saying that anxiety promotes arthritis or just aggravates it? Or... So it can be a trigger to arthritis.
When I talk, I've got a presentation in September that I'm going to be doing on stress management. I'm finally sort of getting around to circulating my old presentations again. I did one on stress about 3 years ago, and so I'm going to be recirculating it again in September, and I'll be going into more details as to what the actions there might be. Okay? And then, of course, what happens? Boom. All right. Diagnoses of anxiety have doubled between 1994 and 2004. I missed a page, didn't I? Right. So only about a third of the people who are affected by anxiety are going to receive treatment, of which only about 12 to 15% is actually going to be appropriate treatment. So anxiety makes up about a third of our mental health bill across the nation. Okay. We find that nothing is a perfect cure for anxiety. However, antidepressant medications and brief structured forms of psychotherapy such as CBT seem to be effective about 60 to 80% of the time. That's a lot more effective than our interventions for heart disease, which only runs at about 50% effectiveness. However, unfortunately, one of the things that holds people back is the social stigma attached and the lack of resources for effective treatment. All right, here we go with Walt Kelly again, aka Pogo. An agnostic is someone who doesn't know, and a die is a Greek prefix meaning two. So therefore, diagnostic is a person who doesn't know twice as much as an agnostic doesn't know. So I want to say that what I'm offering here sometimes appears to be common sense. It also sometimes appears to be something that you're already doing, and so good in preventing work. However, I will also say that if you are having difficulties with worry, with anxiety, then sometimes it's useful to pick up a book that's specifically geared towards anxiety, or perhaps even go to a therapist so that they can dig a little bit deeper with you. Okay? So here we go. This is the basic CBT model. You will find this picture drawn in a variety of ways. It has the same basic components over and over again. Different people add in little bits, subtract little bits, but this is the basic model. So I'm going to say that there are 4 things in life, and that's it. And that is your thoughts, your feelings, your body, and your action. Now, I'm not brazen enough to say that this is the only model that exists. If I were a medical doctor, obviously I'd have to include genetics. If I were a priest, obviously I would have to include spirituality. But I'm neither. I'm a psychologist, so I'm going to use this model and say thoughts, feelings, body, and action. Those are it. That's your life. Okay? Another thing that you will notice is that I have little arrows interconnecting all these things, which basically means that all these things are interactive. It is virtually impossible to have one thing in isolation without it affecting the rest of the system, right? And so you will find that the body and the feeling are interactive, which is interacts with your thoughts, which then interacts with your actions, etc., etc. So, and then of course too, then we have anxiety, where things start to spin out of control and they start to spin down this downward spiral, and it gets more and more miserable the more farther you go down. The good news is, or at least from a CBT perspective, is the good news is that if I can find something to stop the body from doing the same thing over and over again, if I can find something to get you to stop doing the same old behavior over and over again, if I can find something to help you think in different ways, if I can find something to help you feel differently, then what's going to happen is that you're going to be going along, and all of a sudden we hit here, and you can't go any further because now all of a sudden you've changed the way that you're going, right? And so then you can only go one way, which is back out, which is expansive, which is going to be happy, all right? Same with if we can change things at the body, the actions, etc., etc. So this then gets into, so how would a therapist using CBT possibly intervene at each of these places? Okay? So I start with the emotions. And I'm going to say, you're going to worry. All right? All of us do at one time or another in our life. You're going to worry. Now, if the worry seems to be kind of excessive, why not start scheduling it? Why not start getting it in a particular place, right? And this is what we call worry time. So what this entails is a number of steps, okay? One of the things that you want to do is you want to find a particular location to worry in, all right? And so you do not want to pick locations that are familiar to you. So you don't want to pick, say for instance, the bed. You don't want to pick your favorite armchair. You don't want to pick your seat at the dinner table. Pick a different seat at the dinner table to spend some time worrying, okay? It's very important that we break our regular routines. And so worry time, we're going to sit somewhere where we wouldn't normally sit, or we're going to lie somewhere, or we're going to stand somewhere where we wouldn't normally stand and sit, okay? Secondly is you also want to have a consistent time, both when it's going to happen and for how long it's going to happen, okay? And I have a tendency to suggest that when you're first starting worry time, that you're going to want about a half an hour that you're going to dedicate. So for instance, from 7 until 7:30, I'm going to dedicate that specifically to thinking about all the worries that I have. Work, partner, kids, life in general, etc., etc., okay? Then the next step is you want to carry something on which you can record all your worries. So isn't it wonderful that they have an iPhone app where you can actually download and it'll help you record all your worries. Carry a little notebook, carry a little recorder, anything that you want, something that is going to record your worries. Because one of the things that's going to happen is that if you don't record these, then by the time you get to worry time, you're going to have forgotten all the worries, right? And so you want to record these down. Now, at first, so basically the idea is you write the worry down, you say, thank you, brain, for bringing this up, and I'll get to this tonight in my location at 7 p.m., all right? At first, the brain isn't going to trust you, and that's going to work for all of, what, 2 seconds, right? Once the brain starts seeing your consistency that, yes, I set aside every night from 7 to 7:30 in that chair over there, for example, to worry about all my stuff, then the brain starts trusting you when you say, thank you very much, and I'll get back to it later, and it starts letting it go more easily, okay? It is difficult at first. And then when you're in the middle of worry time, well, as I said earlier, you're going to worry, so worry, all right? Now, after your worry time is done, and this is important, is you then want to be able to schedule in an activity that is going to absorb your attention, something that is going to be pleasurable, all right? So you might want to go for a run at 7:30, maybe every night at 7:30 is when you go for a quick jog or something like that. Perhaps 7:30 is your favorite TV show, and you're going to watch your favorite TV show at 7:30 each night, okay? You need something that is totally going to be able to distract you from your worries, because we all know that once you start the ball rolling, you might not want to stop, right? So, this is worry time. Basically the idea you're going to worry, so let's start scheduling it so that it doesn't take up your whole day. All right, and here's an example of the wrong way to worry. Worrying in bed, dear God, please let that paperclip be strong enough, right? This is the wrong time to worry. This is the time when you're supposed to be falling asleep, and yet people are often so busy during the daytime that this is the only time they really have to worry. And this is why I say, schedule it somewhere else in the day. Don't schedule it at bedtime, okay? All right, then we move on to the body. And so in the body there are two interventions that I suggest. The first of those is some form of relaxation, meditation, whatever. Relaxation can take on a variety of modes and methods. There is lots of work being done out there right now on something called mindfulness meditation. John Kabat-Zinn, these kinds of people. There's some other people out there, Jack Kornfeld. All these people are doing wonderful work in mindfulness meditation. You can go to the website, you put in mindfulness meditation, you'll be able to download all kinds of tracks. Right? Another alternative to relaxation would be you go to somebody who actually makes CDs, such as myself. I do a basic relaxation CD, that kind of thing. Relaxation, though, doesn't mean something as formal as that either, though. Relaxation can also be sitting at the window and really taking in the view and going, wow, isn't that a beautiful day out there? Look at it, wow, compared to yesterday, right? So that can be very relaxing, just sitting there taking in this beautiful scenery. A walk through nature is a wonderful way to relax. A cup of green tea is a wonderful way to relax, all right? There are all kinds of ways that a person can choose to relax. There are a couple of formal ones, the relaxation CDs with meditation. But there are also informal ways, right? Take the time to relax. Relaxation is good for all kinds of things in the body, and so take the time out. It helps reduce muscle tension. What else does it do? It reduces heart rate, blood pressure, reduces negative emotions, improves breathing, increases pain relief, improved sleep, increased libido and fertility, increased digestive regulation, increased immune function. Well, to some degree, where we got our big start in relaxation is a fellow by the name of Herbert Benson, who back in the 70s was looking at stress. And he realized that the complete opposite to stress is something called the relaxation response. And he actually coined it that and wrote a book about the relaxation response back in the 1970s. I thought the guy had dropped off the map, but he's still here, he's still pumping out the research, and he put out some very cool research in 2008. Benson realized that, you know, relaxation appears to do good things, it feels good, but does it really work? And so he went all the way down to the level of genetics. He did something called microarray analysis, which we don't have to worry about. It's just a very fancy genetic thing that he did. He got a bunch of people who were regular relaxers, compared them to people who don't regularly relax, meditate, whatever you want to call it, and he found some astonishing results. He found that long-term daily practice of relaxation techniques help reduce the effects of chronic stress at the level of our genes. This means things like pain reduction, reduced inflammation, I always screw this word up, apoptosis, that's your natural cell death. That's the thing, by the way, that goes awry when you have cancer. Right? Lowered blood pressure, increased antioxidant protection. So these were all things that are like, wow, and they were very significant. You take a look at this probability, that means it was very, very significant. So, relaxation, real good thing. Some people think that, as I said, you know, there's various forms of relaxation. Some people think that doing something like perhaps smoking is relaxing. And I'm going to say, well, actually, smoking has kind of a weird double effect. In actuality, it doesn't relax the body. It might relax the mind in that when you have a cigarette, what you're doing is you're reducing the craving for nicotine. And so therefore, it feels relaxing, but in actuality, it's actually pumping up the body. So cigarette smoking, same with alcohol, it's not very good for you. Okay, so that's the one aspect of the body is relaxation. Then I go to the complete opposite end of the spectrum for the body, and that is exercise. This slide is a little funny, or fuzzy, but basically, here's exercise and anxiety. There are plenty of studies out there that look at anxiety and exercise, and all of them basically come up with the same results. I picked this one because it had a unique little feature in it. Basically what they had is they had 3 groups of people, okay? And one group of people was asked to find a route that was about 4 miles long and begin to start walking it. And the attempt was to, by the end of the 10 weeks, run as much as possible of that 4-mile long route, okay? You start off by walking and you slowly work your way up. There was the medication group who got something called clomipramine, which is an old-style antidepressant. It's very effective for anxiety. And then you got a placebo group who got basically a sugar pill. So this will help you. Now, there are some weaknesses in this particular study, but there are some strengths. The strength being that they're comparing it to doing nothing. All right. One of the weaknesses is that they used a variety of different little scales to get their results. And these are nice little scales, but they're really sort of anxiety screeners. So what we have here is we're using the Hamilton anxiety scale, and we find that the medication and the exercise over a 10-week period are equally effective at reducing anxiety, whereas the sugar pill basically did nothing and the person stayed the same, all right? Now, that was using that particular scale. Then they gave people a couple of different scales, and here's worst case scenario. In the worst case scenario, this is a different scale where they find that actually the medication on this particular scale, what it measured, was a little bit more effective than the exercise at reducing anxiety. However, both of them were more effective than doing nothing, a placebo. Okay. Now, to this, I suggest 2 little caveats. Okay. One caveat is that 10 weeks is not a long time to get yourself ramped up and start exercising. And so if you take a look at these curves here, it looks as if, now remember, it looks as if, we can't prove this because the study ran out at 10 weeks, but it looks as if the medication line is slowly plateauing and this, right? Whereas if you take a look at this exercise line, it sort of looks like it's bumping and dipping and going up and down. And it looks like had they run this study for a little while longer, that the exercise would have eventually caught up, say maybe at the 4-month mark, might have caught up with the medication. And we don't know that for a certainty, but it sort of looks that way, right? The other caveat that I give is, okay, let's see, what are the side effects of antidepressant medication? Well, loss of libido, weight gain, funny taste in your mouth, all these kinds of things, right? What are the side effects of exercise? Well, let's see, we might lose a little weight, we might gain a little energy, we might feel a little more confident about ourselves. What side effect would you prefer to have, right? So, again, it's a matter of exercise is good at helping reduce anxiety. Here's me trying to put myself out of business. This is a scale, it's called the SCL 90, and although this is not anxiety, this is depression that they were measuring. As I say, anxiety and depression quite often coexist. This is me trying to put myself out of business in saying that here's a bunch of people who they measured exercise compared to various forms of psychotherapy, and guess what they found? They found that it's basically equally effective. So you don't need to come see me, you need to go see an exercise therapist, all right? Okay, exercise is good for all kinds of things. It helps burn calories, it helps promote sleep, it releases endorphins. Now, endorphins are your own happy/pain-killing chemicals, okay? These are things that are going to help reduce anxiety. It promotes neurogenesis. Neurogenesis is the development of new brain cells, and sometimes then we have new connections that happen within the brain. You can start thinking about whatever's worrying you in a new way, okay? It increases lung capacity, decreases resting heart rate and blood pressure. It helps prevent cancer, diabetes, and other illnesses, and it's sometimes found to be more effective than antidepressants. So, kind of cool. Okay, so that was feelings, that was the body, and now we move on to a cartoon. So here's a little cartoon, which basically, what if I can't afford college? What if there's a war? What if I can't find a job? What if I end up in a cartoon? What if the cartoon isn't funny? Okay, so this is what might be referred to as catastrophizing, and this is one of the ways that people think when they are worried or when they are anxious. Okay, so obviously this leads us into, so what do we do about the thinking? So one of the ways that we deal with anxiety in the way that you think is we would ask you, so, and this is one of the ways, this isn't the only way, we'd ask you, so what's the worst case scenario? All right? Your boss fires you, your spouse leaves you, your kids turn out to be brats, your what? I don't know, there's an earthquake. Okay, and then, you know, if you're fired, then you might end up having to go and collect pop bottles out of garbage bins. Yeah, that would definitely be a bad thing, and I'm not suggesting it wouldn't. What about, okay, all right. Making a little political joke here, you'll have to excuse me, a fate worse than death. However, one of the things that I know about life is that with life, we're not very good at predicting what the future will bring. And so to some degree, we flip a coin. And what happens is, oh dear, the worst case scenario is going to happen, right? But isn't it true that it is equally as possible to flip a coin and go, hallelujah, the best case scenario is going to happen. And so it's important, or at least from our perspective, it's important to also think about, well, what's the best case scenario that's going to happen? Your boss gives you a raise, you get a promotion, your kids turn out to be geniuses and happy, etc., etc. So it's important to counterbalance the worst case scenario with the best case scenario. And you'll see me, if you ever come to see me in therapy, you'll see me do this a lot. It's all about balance. There are bad things that happen to good people. You're absolutely right. There are also good things that happen to good people. And when a person gets in a state of anxiety, when they worry too much, they have a tendency of only focusing on all the bad things. Right? Okay, so here we get all these wonderful things, promotion, raises, trips, whatnot. And then I go to the next question. Oh, wait a minute. Then I go to a little cartoon. You worry too much. It doesn't do you any good. It does for me. 95% of the things that I worry about don't happen. Okay. So now I go to that question and I say, okay, in real life, how often does the worst case scenario actually happen? How often does the best case scenario actually happen? I don't know about you guys, but I haven't won the lottery yet. And I don't know about you guys, but I'm standing right now, so I'm not dead yet. So, best case scenario hasn't happened to me, worst case scenario hasn't happened to me. So, what's the most realistic case scenario that's going to happen in life? And it's important to examine that as well. Okay? So, once we have an idea of what's the worst, what's the best, what's the most realistic case scenario, then we want to ask you, okay, so now that you know what those scenarios look like, how are you going to cope with each of those? In particular, because it's most likely that the most realistic case scenario is going to happen. Your boss is going to chew you out, but he's not going to fire you. He's not going to demote you. He's just going to chew you out. How are you going to cope with that? Right? The Office of Strategic Scenarios. Best case, worst case scenarios. All right. What are some other things that we can do for anxiety? One of the other things that we suggest that helps some people is these what are called coping self-statements. Talking to yourself, talking yourself through this, okay? You're starting to worry. One of them would be just plain old stop. Right? Other ones would be, you know, I've been in similar scenarios and I've worked my way through it before. I can work my way through this one. What else do we have here? You know, my heart races, my blood pressure's up, I'm, you know, breathing's harder. When I go up, climb a set of stairs, oh, this is similar. So, I'm obviously not going to have a heart attack. Okay. What else? If you're right, that's a possibility. That doesn't make me wrong. It just makes me differently experienced, different perspective on life. Right? What are some other things? No, this isn't comfortable, but I can write it out. And then, of course, the last one, which is a real important one, and will eventually lead us into the last set of things, is worrying about a problem is the real problem. Doing something about it makes all the difference. So this is also useful, coping self-esteem. Talk to yourself. Talk yourself through this. So when we start talking about action, when we start talking about doing things, I'm going to suggest that if you have time to worry, then you have time to take action. Right? If you have time to worry, then you have time to take action. Start taking action. When we do research on what is the most effective out of these four things to do, action is the most effective thing in alleviating anxiety. Usually. Okay. So if you have time to worry, you have time to take action. And then people will come to me and they will say, well, I don't know what to do. In which case then I would say, okay, do anything different. Do anything different. Now, there's a fellow by the name, you'll see that I'm going to flash these guys up at the very end. There's two guys that I want to note here. One is a fellow by the name of Stephen Hayes. And so he says, if you continue worrying and taking no action, then you'll just continue in getting more of what you really don't want. Okay? And Bill O'Hanlon says, do one thing different. Change the frequency of what you're doing. Change the time at which you do it. Change the hand you normally brush your teeth with. I don't know. Change anything. Do one thing different. All right? What is the definition of insanity? The definition of insanity is doing the same thing over, over, and over, and over, over again, and hoping that the other person will respond differently. Okay? So do something different. Quite typically, in some cases of anxiety and worry, what I see this, is I will see a person, their anxiety starts to build, and they start to get worried about their anxiety. And right about here is where they go, if I don't do something, I'm going to go right off the page. Right? And so they engage in these, what I call, compensatory or avoidant behaviors. The problem is that never allows you to master your worry, that it never allows you to fix the problem. So avoidance could look like, well, there's a variety of different things, like why don't we go get drunk? Maybe if I work overtime, I'll get this. If I turn a blind eye to what my partner is doing, then maybe it won't actually be happening. These kinds of things, all right? So these are these compensatory or avoidant kinds of behaviors. But one of the things that we know is that emotions, in particular anxiety, is much like a wave, right? And as with all emotions, but in particular anxiety, it comes up, goes way up, makes life really, really uncomfortable, and then it goes back down again. Now, there are some cases in which, so the case that I would give an example of is, there is the case whereby, say for instance, I'm walking across the street, and all of a sudden, oh, there's a bus coming at me. Well, in that case, that's real. That's something I have to do about, something about right now, right? And that's real fear, and that's something that could, in theory, actually kill me. Most of your worries are not something that is going to kill you. They're going to make life uncomfortable for you. That is true. But most of your worries are not going to kill you. Right? So, ride the wave. And how do we do that? So, we want to get into mastery. Mastering, riding the wave, and doing something different. And so there are basically 3 different ways that we can change. And this is based on a lady by the name of Younger. Basically said that there are 3 ways that you master that you can master things. One is you can change the environment. Now, generally, most people, what your environment is another person is causing you stress, another person is causing you anxiety, right? Sometimes we do worry about things, like if there's an earthquake here, okay. But most of us worry about, what's my partner doing, what are my kids doing, what's my boss doing, what are they trying to accomplish, what's my coworkers doing. So when I talk about the environment, I suggest change the person in front of you, okay? And I'll get into details on that. Then I say, then there's another one which is change the location. That to some degree means stop dealing with this individual, go somewhere else. Okay? And then last but not least is change yourself. So, changing the environment. Confront issues with your boss. Go to your boss and say, boss, you seem to be unhappy with me right now, and I'm just wondering what is happening. Are you really unhappy? And if you are, then what can I do to improve in your perspective? Or sometimes what will happen is the boss will say, and here's what would make me happy. If you were to do 16 hours worth of work in 8 hours, well, that's where you're going to have to confront the boss and say, boss, I got 2 legs, I got 2 hands, I can't work any faster. Right? So it's really being able to assert yourself. Who else might we need to confront issues with? Our spouse, our child, our family, that neighbor, that noisy neighbor, or that neighbor who never mows their lawn. Sometimes, I also get into other things and I say, okay, so sometimes it's also important to confront your doctor. Your doctor, and that includes your psychologist, who would be a doctor too. We know lots of good stuff, but who knows you better than you do? Right? It's important to consider what we have to offer you, but who knows you better than you do? So sometimes you have to confront us. And, of course, last but not least is sometimes you've got to confront your elected representatives. I'm going to stand on a soapbox here for a moment, all right? One of the organizations that I contribute a little bit of time to right at this moment is I'm contributing a little bit of time to the BC Psychological Association. One of the things that this BC Psychological Association is trying to do is they're trying to make mental health services more accessible to the public. Because as you noticed earlier, it is quite a tax on the system. And so here's me standing on my soapbox saying, we're having a tough time doing it on our own. We're heading into an election year. Do us a favor. Write your elected representative, okay? Tell them we need some stuff changed as far as mental health services are concerned. All right? Okay, now I'll get off my soapbox here. Confront your elected officials. Take the time and the effort to create a safer and more relaxed work or home environment, all right? Quite often we have clutter, we have noise, we have these things. Time to start decluttering, it's time to start making things quieter, these kinds of things. Again, with changing your environment is start a support group, start a political rally, start a political party. We had in Alberta just recently, we had the Alberta Wild Rose Party, who gave the Conservatives a little bit of a run for their money. Down in the States, we've got an interesting group of people called the Tea Party who are doing some interesting things down there. As to whether or not we agree with them or not is another thing altogether, but still, here are some people who really took up the cause and said, we don't like this. And they're confronting their elected officials in a large group. Start a petition. Remember what happened with the HST petition? Well, we're
We
still
still have it.
working on that one.
We still have it, welcome to it, right?
We're still working on that one, but
I was depressed until that came along.
yeah, exactly. Alrighty. So, changing location. Sometimes it is clearly obvious to us that the boss has your number. He's just looking for an excuse to get rid of you. And I'm going to say, okay, if you know that the boss has your number, he hasn't fired you yet, take some time now to start looking for the job rather than trying to work tons of overtime, hoping to appease the boss. Like I said, what's the definition of insanity, right? You have time now to look for that job, right? Sometimes it requires confronting the boss, but sometimes if the boss is going to be totally obstinate, it's important to think about leaving. All right, consider reprioritizing your energy. So this would mean things like reprioritizing your energy towards work. As I say, start working the 8 hours as opposed to all that overtime. Start reprioritizing the energy towards things that will be more relaxing, more fun for you. It's a beautiful day out there. I'm not sure why we're all sitting in here listening to me trawl on. Exactly. Alrighty. So, same thing with safety, making sure that you create a nice, safe environment, these kinds of things. Alright? Alright.
Excuse me. I don't think your camera is working. I don't know if it's important. No, this one here.
Oh, is it not working? Oh, it sometimes.
There's a message. Stop now.
Is there a message?
Yeah, oh, I can't read. I can't see without
You're
glasses.
behind the image.
I think what it's saying is it can't back me up.
Ah,
Well, when
No.
you walk in front of the image.
It's what that is that's an email coming to me.
oh. Let's carry on.
Hopefully the camera is still working.
It's
All right.
a good word.
Here we go. And last but not least is doing something different inside yourself. Doing something different for yourself. So, in particular, learn how to choose your battles. Learn how to set boundaries. Learn how to be assertive. Learn how to say no. Right? Too many people worry, and when I start asking them, what is the biggest problem, is that they don't know how to say no. And they just keep on taking more and more stuff on, right? So, here's a fun one. Changing yourself. Survey others and find out how they cope with the same situation, okay? I've done this a number of times, and I still remember one client in particular that this worked really, really well with. This client, this was many, many years ago, this client came to me and said, oh, work is really, really bad, the boss is really nasty, and all this kind of stuff. And I'm just not coping, I'm just worried, I'm tense, I'm not sleeping, all this kind of stuff. And I said, I gave her some ideas on things that she could do, but one of the things that I said is, okay, so one of the things I want you to do is I want you to go to your workplace and I want you to go survey. How do your colleagues deal with the same boss? Okay? The other intervention that I gave her was an intervention, it was a variation of the intervention that they give you for stage fright. When an actor or a musician goes up on stage, they will tell that individual, go up on the stage and imagine your audience naked, right? And that will help alleviate the anxiety. So I gave her a slightly different one, and I said, okay, when your boss starts yapping at you, all right, in your mind, imagine painting a clown face on this individual. It is really hard to take a person seriously if you have a good, strong enough imagination. It's really hard to take a person seriously who is chewing you out and yet at the same time is wearing a big red nose on the end of their nose. Right? So this individual went to her workplace. She came back with two interesting little things. One is she found out that she was probably coping the best out of everyone else. Everyone else was doing drugs and alcohol just barely to cope. Others had found that they were taking stress home with them and that they were having marital issues and stuff like this. So she was actually coping pretty good. She was kind of surprised at that. Two is she found one employee who said, yeah, you know what I do is whenever the boss starts yapping at me, I imagine a dog face on them. And I imagine at the end of their chain, like a yappy little dog just going, and I just wait for the dog to tire itself out, and eventually it goes away, and then I just go on and do my job. Wow. Okay? So this is something that you can do inside yourself, changing yourself. Other things you can do. Go back to school, take courses. Oh, great. What else can we do? I had mentioned earlier is that, and I had mentioned this, and I said, what's the worst case, what's the best case, and what's the most realistic scenario? And that is that we can't really predict the future. And life is somewhat ambiguous. Right? So learning to have a little bit of tolerance, toughening that ambiguity thing within inside of you so that you're able to tolerate ambiguity a little bit. And of course, do more stuff. I see people worried and so focused on what's worrying them that they spend no time in life having fun. Quite often one of the interventions that I'm handing out to people is, okay, let's start having more fun in life. Do something that's fun, do something that's meaningful for you. Okay? And this helps build self-esteem, which gets me to the next one, which is making sure that when we're having fun, when we're moving forward, these kinds of things, is that another thing that can really make worry go over the top is when we have these unrealistic goals, when we say, I need to fix all this. Well, yes, you do need to fix all this. The problem is you're not going to be able to fix it all at this moment. So let's break it down into sizable chunks, all right? You get this little piece fixed, you get a sense of accomplishment. Then you get another piece fixed, you get another sense of accomplishment. Slowly you're building your self-esteem. Slowly the ball's rolling in your direction. Of course, Lao Tzu too, he said, a journey of 1,000 miles must begin with a single step. The other thing is don't set dead person goals. I get a lot of people, I even had it this afternoon, clients saying to their partner, don't do this. Or people will say, I'm going to set a goal that I'm not going to eat as much. Okay. I'm going to set a goal of, I want to stop smoking. Okay. These are quite often referred to as dead man's goals, dead person goals. Why? Because a dead person can stop smoking much easier than you can. Right? So the important thing is to focus on not the negative aspect of it, but what's the positive, what we would call the positive aspect of it. So instead of saying I'm going to cut down on smoking, it would be I'm going to start perhaps exercising more so that I can start filling more oxygen into my lungs. If I'm going to lose weight, it might be I want to start buying smaller clothing. Does that make sense? It's kind of confusing. All right. So, let's see. Do I have anything else that I want to say? never be able to eat it all before it spoils. How about a rabbit or something instead? So again, I've done a whole lot of talking here, and so I think it's about time that we stop talking, and I invite you to ask some questions. Just one last thing though that I want to point out is a couple of resources. There are tons of resources out there, but a couple of resources that I like. One would be the Anxiety and Phobia Workbook by Edmund J. Byrne. Of course, I mentioned these two guys. There's Bill O'Hanlon, Do One Thing Different. You have to be careful. He has a very wry sense of humor, though. And then there's Stephen Hayes, who has Get Out of Your Mind, Get Into Your Life. Of course, then there's also some other things, like Anxiety BC. They've got a great website with all kinds of resources on it, and workplacebullying.org is another good place to do all that kind of stuff. Okay, so we're going to go to there, and I think we're just about done. Is that okay? I'm going to turn this thing off, and then if you guys have any questions, I'll invite questions. If that's okay. Alrighty? Okay.
Do you have any more of this for paper? I think it's in paper. Okay.
Of the handouts? Yes.